today?
Hi, good, and you?
Good, thank you. My name is Rachel, and I'm going to be your nurse. Can I get your full name and date of birth before we start?
Sure, I'm Gina Carrasco, and I was born on July 4, 1989.
Well, Gina, what brings you in today?
Well, I've been feeling really tired lately, weak, and sometimes I'm happy, sometimes I'm sad. I'm just concerned. I'm like having some disease or something.
Okay. When did you notice this start? You said about a month ago?
A month ago, yeah.
And have you been taking any medications for all these different symptoms?
No, nothing.
Okay. Well, I'm so sorry to hear that you're dealing with this. The doctor has ordered some blood tests, so we're going to monitor your hormone levels, make sure everything's where they need to be. Go ahead and take this down to the lab, and they'll go draw your blood. It takes about 30 minutes, and then come back up here when you're done, okay?
I'll be right back.
Hi, welcome back. So your lab results have come back, but before we go over them, can you please give me your full name and date of birth again?
You don't remember me anymore, or what?
It's just standard protocol for a hospital. Make sure we give the right patient the right lab results.
Okay, so I'm Gina Carrasco, and my date of birth is 7/4/89.
All right. So looking at the lab results, I've noticed that your hormone level of thyroxine is a little low, which is the hormone produced naturally by your thyroid. So this is when the thyroxine's low, it's known as hypothyroidism. So to compensate for this low level of thyroxine, the doctor has prescribed Synthroid, which is a synthetic hormone identical to thyroxine that will kind of trick your body into making the levels back up where they need to be, okay? This medication is given orally. Make sure you don't eat or drink about an hour before taking it because it's best absorbed on an empty stomach.
Oh, but you know what? I have a really hard time swallowing pills. Is there anything else I can do?
No worries, absolutely. You can go ahead and just crush it up and put it in 5 milliliters of water, about a cup of water, and make sure it's completely disintegrated and drink it. Don't just let it sit there for a while. Drink it immediately, okay?
That sounds good.
Are you taking any other medications, vitamins, or supplements?
I take calcium every morning.
And how many milligrams of calcium do you take? Do you know?
It's 500.
500? Just so you know, some vitamins like calcium can interfere with the absorption of Synthroid. So make sure you take Synthroid 4 hours before taking calcium, okay?
Okay.
To be able to get the levels of calcium and Synthroid where you want them to be.
All right. Are there any side effects I should know about?
Well, with any medications, you have the chance of a rash, itching, hives. Side effects like that are common. But if you experience a shortness of breath, you have chest pain, heart palpitations, you have a problem breathing, go ahead and call 911 and seek medical attention immediately. But these are some symptoms known to be side effects of Synthroid, okay?
All right. What about my diabetes? Will it affect this, or?
Well, Synthroid can actually affect your glucose levels, so just make sure you monitor your glucose levels. You're going to know your glucose levels more than anyone else, so just make sure you throw in an extra couple checks if you start feeling a little funny or anything like that, okay? We'll also be monitoring your serum levels with Synthroid, so every couple of weeks we'll be having you come in. We'll be able to monitor your thyroxine levels and make sure it's where it needs to be, okay? Some foods are known to interact with Synthroid, like nuts or high-fiber foods. Do you happen to eat any foods like that?
Yes, I love walnuts.
Walnuts?
Yeah.
Well, just so you know, walnuts is one of the nuts that affect the absorption of Synthroid, but no worries.
Should I stop eating them?
Not at all. We can actually just adjust your medication to be able to make sure you're getting enough Synthroid levels, okay? And another thing, being female, you know, we like our hair. So just so you know, a side effect with Synthroid, it can be temporary hair loss.
Don't tell me that, please.
But
should I go get some extensions?
It is temporary, so if you notice it, don't freak out. It's completely normal with this medication if you do experience it, but like I said, it's temporary, so it will stop after a few months, okay? Well, Gina, do you have any other questions today?
No, I think that's it.
Just so you know, your medication is ready for pickup down in the pharmacy, and remember to always take your medication on an empty stomach, and we'll see you in a few weeks for your blood test, okay?
Okay, I'll see you.
All right. Thanks.